Recognize the gentleman from Ohio, Mr. Latta, for 3 minutes, please.
Well, thank you, Mr. Chairman. And again, thank you for holding this hearing today. Opioid abuse and addiction has caused devastation in every community across our nation, and Ohio has been especially hard hit. In Ohio, in 2015, 3,050 people lost their lives from unintentional drug overdose. In 2016, that number increased to 4,050. That's a 32% increase from the previous year, and that means 11 deaths a day. For comparison, in 2016, there were 1,133 traffic fatalities in Ohio. That means that drug overdoses caused nearly 4 times as many deaths compared to traffic accidents. These figures are heartbreaking. It's sad to know that this problem isn't getting any better. Many county coroners in Ohio say that 2017's overdose fatalities are outpacing 2016's. This problem knows no limits and has affected husbands, wives, children, brothers, sisters, fathers, and mothers. It has destroyed marriages, ruined careers, and cut too many lives short. When I read through the obituaries in my local newspapers over the past year or two, I've noticed more younger individuals without a cause of death being listed. Unfortunately, in too many of these instances, because of drug overdoses. Across my district in Northwest and West Central Ohio, I've heard how opioid addiction impacts our communities. I've toured businesses, met with community leaders, and spoke with families to hear how substance use disorders have directly affected their lives. It's because of these stories that I plan to introduce legislation that will direct the Department of Health and Human Services to create a public electronic database of information relating to nationwide efforts to combat the opioid crisis. The database would serve as a central location of information for the public and others to track federal funding allocations made available for research and treatment of opioid abuse, find research relating to opioid abuse from all federal agencies, state, local, and tribal governments, as well as nonprofits, law enforcement, medical experts, public health educators, and research institutes. Furthermore, the legislation would charge HHS to evaluate a myriad of issues relating to pain management, addiction, prescription guidelines, treatments, trends and patterns, and effective solutions and problems used across the country. These findings would be available in the database as well, and HHS would be instructed to offer recommendations for targeted areas of improvement. I believe that with the help of HHS and other relevant agencies, this database will allow for easier access of information, funding streams, and relevant data that can help to combat the opioid abuse epidemic across our nation. With 11 people dying every day in Ohio and over 91 Americans dying nationwide every day, we have run out of time to find a solution to this crisis. We need action now. I appreciate the committee for holding this forum to express creative ideas and solutions, and hope it leads to more lives being saved. Mr. Chairman, I appreciate the opportunity to be here, and I yield back the balance of my time.